What's up, everybody? Welcome in. Welcome in. We're going to let people gather here. I see Roel's here. Jack's here. What's going on, guys, on YouTube? So glad to have you guys with us tonight. How's everybody doing? We're getting live. We're getting everywhere. I think we're up on YouTube. We're getting up on LinkedIn. Gonna make sure. Had some Facebook issues last week. All right, Lisa, how's it going? Thank you for sharing. Great. We're getting some. I'm able to see the Facebook comments tonight. Last week I had to use the iPhone there. D. Lynn, what's going on? Judy, hello. Ike, we're hoping Ike's going to be on the show tonight. We're hoping. Carol, hello. Great to see everybody. We're going to let a few more people come in. Doc's getting ready to head this way. As you guys know, this is where we answer your health and wellness questions. We're going to be on Bianca. So good to see you. So good to see you. Carol, what's going on? I see two Carols, Carol Abernathy. My grandmother's maiden name was Abernathy. Fun fact from Dandridge. All right. Hope everyone's doing well. Jack, thank you so much for being here, man. Really appreciate the people who are coming to hang out with us each and every Tuesday. We do this Tuesdays at 7 o'clock. Tuesday, as you guys know, is when we send out Performance Weekly. Carol, we might be related. Who knows? Who knows if you're from the East Tennessee area. All right, Tuesdays when we send everything out, guys. So we had a busy day up on YouTube. We had 3 videos go out, and I'm just going to put a few of these up here because I think they can help a lot of people. This week, Dr. Rogers did his Common Sense MD episode on testosterone pellets, specifically for women with breast cancer. We've gotten a ton of questions around options for women who have had breast cancer before. Because we've talked a lot about hormone replacement and the ambition of this goal was to give those women hope. So if you know somebody with who has had breast cancer, or if you are somebody who is a breast cancer survivor, first of all, we love you, and second of all, check out this video. It was kind of a second parter to last week's episode on breast cancer and hormone replacement. This is where Dr. Rogers debunks the Women's Health Initiative, which was the study done back in 2002 that turned so many patients and doctors alike off of hormone therapy. So our goal with that was to educate people on what actually happened with the study and how bioidentical hormones are protective and they do not cause breast cancer. They do not cause heart disease. We had another episode with my main man, Lucas Schmidt, in Dive Into Diet. This is our newest series that talks all about nutrition, supplements. Lucas is just a wealth of information. And this one, he goes over 6 popular diets, some that most of them you've probably heard of. Fun fact is he actually goes over one of these was the Ornish diet, and I had never heard of the Ornish diet. So he goes over six diets, things like the carnivore diet, the FODMAP diet, and this kind of talks about who it's for, what kind of health conditions it helps with. Super insightful video. And then we had an Explain This episode go up with Robin Riddle, our nurse practitioner in the Knoxville office, on Candida. As you can see in the background there, guys, it explains what Candida is. Specifically, Robin talks about the health consequences of having candida overgrowth, and specifically how a functional medicine office treats it. So lots of cool things. It seems Doc is about ready to go, but I got to do one quick thing because I'm so excited about Emily. Emily Curitan is joining our team. That is her. I believe it's to your right. To the left is my sister, Kelly, our other esthetician up in the Tri-Cities. Jasmine Allman, of course, is our esthetician in Fountain City and in the Knoxville West office. But this is Emily. She is joining us as of today. She's doing an open house November 1st through November 11th. If you guys are familiar with our Kingsport locations, Emily will be in the Red House, which is right next door to the Performance Medicine White House. So go in, say hello to her, and welcome her, please. So excited to have Emily on board. We're going to get ready to go, guys. Stephanie, I see you from the Kingsport office on YouTube. Thank you so much for hanging out. Grandma Mary, I love you. Thank you for being here. Jack, I see your question. Great question. And I see Deborah's here. What's going on? All right. Is Doc ready to roll? I am. It's funny. Everyone thinks that somebody's talking to me in here, but no one is. I'm just talking to myself. What's going on, man?
Hey, Ben. How are you? Good. Good.
How was the day today?
Oh, we had a great day. It was a fantastic day. Saw a lot of great patients and had a lot of fun.
What's that orange you're wearing? This is not a normal performance medicine show
like
attire for
you. Well, University of Tennessee, where I went to school. I mean, we're ranked number 2. So, when we play number 1 Saturday, so it's kind of a good time to be a UT football fan.
God, it is such a big week. I was talking with Katie about this yesterday, just how big of a game Saturday is. If you guys, I'm sure we've got a lot of Tennessee fans on the show here, as we're from East Tennessee. So it's an exciting time. Hendon Hooker for Heisman. Just such a fun time to be a Vol. So shout out to all the volunteers in there. I see Katie's repping the orange as always. And I'm sure we've got plenty of
what
other.
What does GBO stand for? Go Big
Go
Orange?
Big Orange. Come on,
GBO.
man.
I don't know these millennial terms like GBO or some of these others. I don't want to mention.
You got to hang out with Tony Basilio last week.
Yeah, we had our grand opening at the Fountain City office and on Friday, and Tony Basilio is an amazing Vols commentator, has a great talk show, and we spent 3 hours talking. John Adams was on there with us, and I did make a promise that I'm not sure I should have done. Tony said I shouldn't have done it, but I did. Our office in Fountain City is situated right beside the famous duck pond of Fountain City. And so I made the statement that if we beat Georgia, that I would jump in the duck pond. And it has a lot of algae in it. It doesn't look like a real pleasant swim. But,
I tell you what, our Fountain City office is absolutely gorgeous. And that duck pond, I think it's a beautiful pond, but I definitely wouldn't want to bathe in it or like take a dip.
No, I'm starting to worry,
I see Lucille here. Lucille is in Mexico. Thank you so much for hanging out. Bo Nix, come on, Bo Nix.
Oh, come on, Bo Nix transferred from Mississippi, didn't he?
No, was he Auburn or Mississippi? I think he was Auburn.
He was one of those other programs. But yeah, I think Hendon Hooker for Heisman has a better ring to it. Although Bo Nix is good, I have to admit that he is good.
He is good. He is good. Shout out to the Vols here. We're going to be. I'm sure a lot of people on the show tonight are going to be somewhere Saturday watching the game. So can't wait to recap that next week. Doc, they're not here to listen to our Vol commentary.
This isn't the Peyton Eli show, is it? Okay, it's the Ben and Tom show. Okay.
They can check out Tony Basilio for that. We're going to talk about some health stuff. We're going to go over some health questions. I see Montana's here from our Knoxville office. So good to see you, Montana.
Hey, Montana.
Great to see you last week at the grand opening. Okay, we're going to get to some questions. And I love this first one because we're getting a lot of comments on some recent posts on Facebook around testosterone levels in women. So I'm gonna give some context here. The question is, what are normal testosterone levels for women around ages 45 to 60, and then give some context as far as where she's at. My test results to recent blood work show my level at 396, and Dr. Patrick thought that was very high. So at my appointment, he had me do more blood work to see if there was a mistake. A week later, it showed 189, which still seemed high. So he adjusted my hormone cream, and still feel like it feels like it may have dropped too much. So I'm sure this is something that you see a lot. First of all, is it normal to get that much of a variance week to week on a level like that?
I mean, it can flow around a little bit depending on absorption. If you're on the cream, that's why I really like the pellets, over anything as far as method of putting hormones on. But yeah, you were running on high test, and now you're running on premium. So, really, there's no normal testosterone levels for women. You want to get the level that you feel the best with. And if you look at my podcast from today, I talk about testosterone pellets in women who have had breast cancer. I hope you'll look at that and you'll share that with women that need to hear this message about, because they've had breast cancer, they can't take hormones. Well, they probably can't take estrogen or progesterone because most of them are ENP receptor positive. But you can take testosterone, which is really the one that makes the biggest difference anyway in the way you feel and with everything. And the deal about that is if you go to my podcast from today, and also I can, we're going to print up some of these studies that, we have had with that I sent you about testosterone being so beneficial to women with breast cancer. So not only can you use testosterone unless you had a triple negative pathology on your breast cancer, which is a rare one, more aggressive one. That means you're negative for estrogen and progesterone receptors negative, and also HER2 negative. You should not do testosterone in that case, but that's a rare aggressive type of breast cancer that you need other aggressive forms of treatment. But for most all the other, all the other forms of breast cancer, once you finish your treatment for breast cancer, then you can get testosterone pellets. And especially for those women that have to use tamoxifen or letrozole that just wipe all the estrogen out of your system and cause a lot worse symptoms of menopause than you're normally going to go through anyway. Testosterone pellets, in my opinion, are the answer. And the deal about it is not only will you feel a lot better, it decreases your chance of recurrence of breast cancer. So maybe by up to 40%. So most people just don't know this. As you know, women, you may not know, women have way more circulating testosterone in their bodies than they do estrogen, by 20 times. So testosterone is an important hormone for women. It's the one they come in and thank you for the most. So as far as levels, there's really no normal level. And in women that have had breast cancer, I use a little bit more testosterone in their pellets than I do in women without a history of breast cancer, because they need to bind up some of those estrogen receptor sites. Also include anastrozole in their pellet as well, which is an estrogen blocker. It's an aromatase inhibitor. It's not one of the real potent estrogen wipeouters like, tamoxifen or letrozole. So that doesn't have the side effects that those do of osteoporosis or increase chances of cardiac events and blood clots. So it's very safe, very mild. But the testosterone in itself is a major deal for women. And so there's no really normal level. Most women that I see like their level over 100. Now, sometimes if you're getting up over 300 and you're having facial hair, the only side effects I've seen with testosterone is you could have a little bit more facial hair. I don't see it a lot, but sometimes, a lot of times, postmenopausal women have this anyway. So you just laser it off. I rarely see acne with testosterone in women, but occasionally. Um, but it's just a great thing. I always make sure that when I give unopposed testosterone that a woman doesn't have pre-existing cardiac disease. But that's just part of our normal workup, say when you get a Cleveland panel. But look at testosterone. So, you might like a level of around, 200, 150, 200. That doesn't bother me unless you're having too much facial hair from it or for some other reason you may have some other side effect. People think, well, I'm going to get too aggressive with testosterone because it does increase your libido. It enhances muscle development, but it's really, I just see better moods from it, almost more calm, focused moods. Testosterone is a memory hormone. So, if you can't have bioidentical hormone replacement because of breast cancer, then look into testosterone because it's also very bone protective, but very brain protective. Also takes care of a lot of the symptoms like hot flashes, night sweats, mood swings. So think about testosterone. It's amazing that docs just don't know much about it. But I've dived into the studies. I have experience with thousands of patients in doing it, and it's just an amazing, great treatment for women.
So the fact that they went from 396 to 189 because it dropped that much, do you think that's why they're feeling like it might have dropped too much and maybe they might be?
Maybe. I'm not sure if they changed your dose or not, or just wanted to recheck it to make sure it wasn't, an abnormal variant. Sometimes when I get a lab test that, I'm not sure why, I'll just recheck it just to double check because laboratories do make errors. Depending on how long the blood sat around, et cetera. But yeah, it still may seem a little high to you, but it's really not that high. Just go more by how you feel. And certainly we check all the other levels because you could get a little aromatization of testosterone to estradiol. So keep an eye on, as we always do with all these patients. So I hope it helps you. Don't freak out. Get it checked out. If you're feeling great, I'm okay on a little bit elevated level.
I see a comment here from Robert on one of our posts, just asking, curious what negative side effects you see most in testosterone therapy in women. I'm hearing from you that it's maybe sometimes facial hair. Is that the only thing you're seeing?
Rarely acne.
Okay.
I've seen gosh, there's a couple other, you could get clitoromegaly, you could get a little bit deeper voice. But usually that's going to be a pretty high level in a prolonged situation. So, just monitor it. Women need about an eighth to a tenth the level that a man does. And on a men, I like to keep their level 900 to 1,000, somewhere like that. But I just see better mood changes. Some people say, well, I may get too aggressive, but I just don't see that. They just feel better. They're more likely to have more energy to go work out, build muscle, which burns fat, better memory.
And I think it goes to show, it is important to, kind of continue to get lab work, continue to kind of monitor it, so that you can take advantage of all the benefits and maybe avoid some of these side effects that I'm sure, many women don't want to go through. All right, let's go on to the next one. Thank you for that, Doc. Great question that came in over email. This is one about melatonin. Is melatonin pregnancy safe? So can you take melatonin while you're pregnant?
You can. Of course, they don't do studies in pregnant women, but yeah, it's melatonin is not going to hurt you with pregnancy. And just take the normal dose that you've always taken and help you sleep. pregnant women a lot of times have sleep issues. I've even seen some reports that it may prevent complications of pregnancy, like preeclampsia and things. So, where your blood pressure goes out the roof. So, yeah, I'm fine with melatonin during pregnancy.
All right. Thank you for that. That came on Instagram. Just a reminder, guys, we're getting ready to go to live questions. So if you have a question for Dr. Rogers, go ahead and put that in the comments. We're getting ready to jump in the comments here in a couple of minutes, and we're going to answer your health and wellness questions. Steve, I see you, man. So glad to have you back here on Tuesdays. Steve Nice is, of course, from Digest Shield. So guys, make Steve feel welcome again. Say some nice things about Digest Shield. Goodness, come on. Let's say some nice things about it. We love some Digest Shield.
It works great. It works great.
Thoughts on getting testosterone shots after breast cancer on letrozole now? You talked a little bit about this with the first question.
Yeah.
Letrozole was something that you mentioned in the podcast today. What would you say to this?
Yeah, pellets. Don't get shots. One shot's okay to get you going, but pellets, you get more of an even level, and we'll use anastrozole with it, which is another milder aromatase blocker for estrogen. But definitely, because when you're on letrozole, it's a heavy hitter that cuts all your estrogen out, and certainly there's a lot of side effects from letrozole, like hot flashes, night sweats, mood changes, things like that. With letrozole, which really is more effective for preventing recurrence of breast cancer than tamoxifen, but you see more osteoporosis with it, and probably more cardiovascular disease than you do the tamoxifen. But which you see more osteoporosis with. But some women just they won't take it. I've had women that just won't take these, even though their oncologist has recommended them. And certainly there's a lot of evidence that it cuts down on, recurrences and helps treat those hormone sensitive breast cancers. But certainly there's, and you have to take those things for years. So you're talking about years of going through these bad symptoms. And again, I'm not against it. Follow your oncologist's advice, but there's another thing you should do, and that's testosterone pellets. Not only will you feel better, like I said, you'll have about a 38 to 40% decreased risk of recurrence of breast cancer. This Dr. Rebecca Glazier that I talked about earlier, I always have a hard time with her name, but that I met out in California, or maybe it was Vegas. But anyway, she's been doing it for years. She's had 0 recurrences of breast cancer with T pellets, and she's done a lot of her own studies. You're not going to see massive studies because testosterone is off patent. Big pharma can't make money off of it, so you're just not going to see the research or the information. Which reminds me of a story I want to tell you in a minute about how doctors get their information for the way they practice medicine that I heard this week. So, certainly if you're on letrozole and tolerating it okay, you can add a T pellet. Very helpful for you. So do your own research and look at the evidence and try it and see how you like it. But the thing I was going to tell you about something that came up that reminded me of that was one of my patients came in this week and was talking to her primary care doctor about, who'd been in practice many years, over 30 years, about as long as I have, how he, stayed up to date on the way he practiced medicine, because she had asked him some question he really wasn't familiar with, which is fine, it's common. But he said, I'll be honest with you, I learned, I keep up to date through the drug reps. It's kind of a sad commentary, isn't it? That's a true story.
That just seems wild to me.
Yeah. Doctors are busy.
Yeah.
They don't have a lot of time to to do research unless they really get into it. Maybe have a niche area, but it's so hard for primary care doctors to keep up with everything. So, yeah, that was his answer, and he's a pretty good doc too. But I thought that was kind of telling and kind of scary in a way. Not that drug reps don't have a lot of knowledge; they do about their particular product,
yeah.
but they're going to push that product. They need sales, so they're not going to talk to you about if they're pushing a cholesterol medicine about your diet at all. They're just going to want to put you on a pill. So, but anyway,
I want to put this
interesting.
up for you. My man Alex is here. Alex,
Hey,
of
Alex.
course, was in he in the white the Kingsport house?
Yeah, he was in the annex, and he did a rotation with us. He's about ready to finish PA school.
Man,
He's from LSU, and I told you, Alex, that we were going to beat you this year at UNC football. And it turns out we're even better than I thought we were. We're going to win the national championship, Alex. You know, and
Alex didn't come here to for us Tennessee fans to is it gloat? Is gloating a word?
we have to gloat a little bit. It's been
I
so
mean,
long since we could even brag a little bit about our football team. You know,
LSU they won a national championship just a few years ago with Joe Burrow, and and it actually after the game with us, they really turned it around. But Alex,
They're
man,
good. They're
I've known
good.
Alex since he was a young gun over in Oak Ridge. It's so great to see you in here, man. Thanks for hanging out with us.
Alex is going to be a great PA. I would
Yep.
go to him in a heartbeat. He's got a lot of experience. He's very smart, has a lot of good common sense, and he's going to be great. He can do anything he wants.
He's turned into a Vol fan. He's turned
He
into
really,
a Vol fan.
that's amazing. I'm really happy about that. Thank you, Alex.
I want to say hello to Chuck. I met Chuck, or I got to see him in Knoxville a few weeks back, and it was just such a pleasure to get to see some of you guys in person. And Chuck, man, it was just so nice to meet you. Thank you for being with us here tonight. We're going to make sure we get to your question. All right, let's get to this question here. I began Monjero. It's still up for debate how to pronounce it. I began Monjero last Monday at 5 milligrams. Took 2 shots so far. I have no energy and no motivation. Just so tired. What can I do? Monjero is, of course, one of those GLP-1 agonists. And, it's kind of a hot thing right now. People are loving Monjero.
Yeah, I do like Monjero too. It's also got another little thing besides the semaglutide. It has a GIP in it. It works as well. But, I wish you'd started out at 2.5 milligrams. That's where you're supposed to start the first 4 weeks. Maybe if you started out a little high, I usually start people at 2.5 for a month and then go to 5. But yeah, I mean, sometimes when you're adjusting, especially with something as potent as these once a week shots that delay gastric emptying and they kind of suppress your appetite, and things are adjusting metabolically with you. So I'm not surprised you're tired. You're probably a little nauseated too. But you can I'd probably just move my dose back to 2.5 where I should have started in the first place and see how you tolerate that. And unless you're having really severe problems, kind of get through it if you need it. I don't know if you're a diabetic or if you just need to lose weight, but cut back the dose to half of what you're taking for a month and see how that goes, and see how you do. Now, if you get severe stomach pain with it, you're vomiting and stuff like that, stop it. You need to try something else, but that's what I would tell you to do.
Thank you for that question. Is there real quick? Is there a huge difference other than I know insurance is a big part of these GLP-1s. Is there any difference really between Mounjaro and Ozempic?
Yeah, there's a lot of difference.
Oh, so there is difference.
Yeah.
Okay.
Yeah, they're 2 different drugs. One of them has a little more in it, the GIP part of that in the Mounjaro. So, I mean, they both work. But I've used a lot of both. Ozempic was there first. I've got a lot more experience with Ozempic.
All right, guys, we're going to jump into the comments here. So if you got a question for Dr. Rogers, we're going to answer it here live for you on the Performance Medicine Show. I'm going to put this up from Dana. Dr. Rogers needs to put an infrared sauna in his new building next door in Kingsport for patients. That's the Red House she is talking about. What you're going to have to do, Dana, is you're going to have to go through Katie for that. And if you can put that past Katie, then we might have to do it, but no promises.
I would not want to go through Katie for that.
I
love my infrared sauna. I really do.
Yeah.
The thing about it, they're not that expensive, and you'll sweat like crazy. So, it'd be a major cleanup of sweat after each patient in there. And I don't know if it'd work out in that small an office, but, ideally, I love the infrared sauna. I like, I'd love to have a nice hard shell hyperbaric chamber also for patients someday.
It seems
we can only hope. We can only hope.
Seems Stephanie mentioned it to you. So Dana, you've got some advocates here on the infrared sauna. We're so pleased with that Red House. Man, we're so pumped to be there and seeing patients in that building. All right, let's get to the questions, guys. Let's get here from Jack. Jack is asking, I'm unable to sleep for more than a few hours a night. I take magnesium and HTP5 at bedtime, and I'm on keto. I don't feel stressed. Maybe the doc can help. What's your thoughts on this?
Yeah, I mean, insomnia is pretty common. I've had it myself, of course. I think mine came mostly through years of going back to the hospital in the middle of the night, taking call, all that stuff, which I don't do anymore, fortunately. There's other stuff you can do. I don't know what all you've tried. Whether you tried melatonin. I like CBD. We have the CBD nighttime version that we came up with. It seems to be pretty good. Sometimes I use a stress formula. If you have that mind chatter at night where your mind just won't quit turning over, I like L-theanine. We have our own stress formula that has L-theanine, saffron, and ashwagandha that's really good. You need to get into a pattern. Of course, you need to do all the normal stuff like sleep in a dark, cold room without any lighting or anything like that in there. And I'm not even against using short-term prescription sleeping medications to get you in the, in a routine to where you can get into a sleep pattern. Sometimes it takes a week or two of taking those. So think about some of the other supplements you may take. I love the CBD. I take a little melatonin myself, the long-acting type. Come talk to us about some of that. There's some ways to get a good night's sleep, but you need sleep. I don't know if you have sleep apnea. If you've had a sleep study, I love my Aura ring that tells me exactly how much sleep I'm getting, how much REM, how much deep sleep I'm getting, latency, how long it takes me to fall asleep, while my O2 sats at night, how much I'm moved. I love my Aura ring. You have no idea how you sleep unless you can kind of measure it. And a sleep study is not out of the question either.
Well, with the Aura ring, what are you looking at more? Are you looking at the REM or the deep sleep more?
Both. They're both deep sleep, what we call deep sleep. But REM is the dream state, but it's a restorative sleep, like stage 4 deep sleep is. Rapid eye movement. But those two are the ones that are restorative. Those are the two that you pay attention to. Tells you your body temperature at night. You may be sleeping in too hot a bed. It's just a great tool for learning how to sleep. And that way you can measure it and you can try different things to see if you slept better.
How much time before bed are you taking your melatonin? Are you doing it like an hour?
An hour, yeah.
All right. Same
thing with the CBD nighttime that I take.
All right. Thank you for that, Jack. Let's get to Roel's question on YouTube. Doctor, what are your thoughts on semaglutide for weight management?
I love it. basically that's Ozempic and Mounjaro that we've been talking about. But semaglutide, you're probably talking about the compounded form, which is available. We order a lot of that if insurance won't cover the other two, but it's still a once a week shot. I mean, I've used it thousands of times. I love it. You can't take it if you've had pancreatitis or medullary cancer of the thyroid, which, I've never seen a case of that. So unless you've had pancreatitis, it's pretty reasonable. It's once a week shot, works great for weight management in those ways I just talked about, delaying gastric emptying, decreasing glucose output from the liver, hits your appetite control center, makes your insulin work better. Great. It's been my favorite tool for the last 2 years at least for weight loss.
All right. Thank you for that, Roel. I want to get to Lisa on Facebook. I've had a pretty bad gastroenteritis. The top of my stomach hurts pretty bad, and I'm bloated terribly and can't even lie on my stomach because it's so sore. What can I do to help this?
I hope you're not taking semaglutide, but yeah, I don't know how long it's been going on, but I mean, you could have an ulcer, you could have a hiatal hernia, you could have gastritis, you could have a lot of inflammation in the stomach. Sounds like the top part of your stomach, which is your stomach and your duodenum. You may even need a lipase or amylase to make sure you're not suffering from pancreatitis. But how long? I don't know how long this has been going on. You can certainly settle your stomach by, well, number one, slowing down on what you eat, avoiding. I'd almost get on a clear liquid diet for 24 hours, maybe some broth, that type of thing. And I'd go ahead and I would take some Pepsid AC, maybe even some Prilosec short term, to see if cutting the acid out of it will help you. I don't know what your bowel habits are like, or if you take a probiotic, or you have a history of IBS, that type of thing, which is a more lower bowel problems. But you've irritated your stomach, it sounds like. I don't know if you've been taking some nonsteroidal anti-inflammatories or the bloating. You can certainly take even Gas X, but definitely get on some Digest Shield. I mean, that's a no-brainer. That's the best gut product for daily use I've seen. You may need some of the other stuff I mentioned for rescue to get it calmed down, because that needs to be looked into if it's persistent. I sent a guy today, had something similar for a scope test to see if he had an ulcer, Barrett's esophagus. There's also a bacteria called H. pylori that causes most ulcers. So if it doesn't get better with those measures, you need to get that worked up.
We did explain this episode on H. pylori where Robin Riddle details that exact thing. So you might want to check that out over on YouTube. If you just search for H. pylori performance medicine, it should show up. We got a Digest Shield fan right here, and Julie, thank you so much for putting that in there, Julie. Thank you for being here. One thing I've noticed
Really?
as we're talking here is I just feel like, is that like a retro Vol shirt? It
is. Yeah.
It just seems outdated to me.
It's very outdated.
Did you get that at Costco?
Actually, Ben, this was given to me as a present many years ago.
Well, you tease with Nike now.
It is?
You tease with Nike, and that's not Nike.
Oh, is this Adidas or what?
No, I don't know what that is, but it just seems old to me.
It is old because I'm old, but it's also orange. It's the orange color, so that's why I'm wearing it. I'm not quite as up to date as you, but
we got to get you.
I spend most of my time, not with the fashion world, but with my nose buried in a book or talking with patients. I don't have time to keep up with shopping. Maybe true. You can get me something for present for Christmas. Ben has access to all the current UT Vol paraphernalia. Ben was an All-American tennis player at UT. So he has access to all the coaches and the swag they have over there at the field houses. And, from top to bottom, he has it. So
First of all,
I'm
I've
not privy
never.
to that. When I played tennis for 1 year at UT, I was a walk-on, hardly ever got to play. Ben was an All-American, so we're on different levels. He's
I've,
talking, he's at a more elite level. I'm
I've
just a
never.
working man. I'm a blue-collar working man,
I've
tennis
never
player.
heard you use the term swag before. And I think we have 40 people with us here live. I don't think they've heard you use the term swag before either.
That's a
So
pretty cool word. I heard it over the weekend.
we got to get to Chuck's question here. Chuck is asking, would LDN help with severe arthritis in the knees? This is a great question.
It is a good question. If you have bone-on-bone osteoarthritis in the knees, it's probably not going to help you much. I use LDN for a lot of different things, but because it does have a great anti-inflammatory effect. But it's more for those autoimmune diseases, like say you had rheumatoid arthritis, or or you have lupus, or Parkinson's, Sjogren's, or MS, or fibromyalgia. It's got a lot of uses, but more for the autoimmune type things than, if your knee's just plain worn out and it's bone on bone. A lot of times you will still have some cartilage in there. What I really like for that's the PRP injections. As you know, if you watch my blogs, I had both mine done. Jill, my PA, and amazing PA in Bristol, with all the ortho experience, injected both my knees painlessly, and it really helped my knees a lot. So, I don't know if you've tried that, or maybe Synovisc, but I'm just not sure LDN is going to help that. It does seem to help with a lot of different types of pain. But I don't know. There's no real guarantee on that. It wouldn't hurt you to try, a month of it and see. So I'm not so sure if it's bone on bone, it may not help that much.
All right, Chuck, thank you so much for that question. Speaking of Jill, we had such an amazing, it was a first annual provider. It was a provider conference for all the providers at Performance Medicine this past weekend. And the reason I'm bringing this up is Jill did a presentation for all the other providers on PRP and what was the other one? It was PRP and was it stem cell, or was it just PRP? I think it was just PRP.
Just PRP. We didn't talk much about stem cells.
But it was incredible. Shout out! We have eight providers now. Margot in Fountain City, Robin in Knoxville. We had Fran, Jill. Goodness, Amber was there.
Andy.
Yeah, goodness, the whole crew was
there. Everybody. It
was amazing. All right, let's get to another question here. I want to get to Lucille's, and I hope I say this right. Can you speak to remnant cholesterol versus high LDL? And Lucille, if I didn't put up there right, is CBN supposed to be in here? What's your thoughts on this? Does that question make sense to you?
Not really, no. When we do the Cleveland panel, we break it up into all the particle size and all that. Maybe one of the most important things about, non-HDL cholesterol, which is probably what you're talking about. You got VLDL, you got chylomicrons, you got a lot of different particles, but probably the most important thing is the ApoB, which represents the size of the particles of your LDL. LP little a is important, which is an inherited form of particularly bad LDL particle. We also look at what your oxidized LDL number is. So, we do a pretty deep dive on that, but I assume that's what you mean. One of the last patients I saw today, I was going over her Cleveland, and she had a moderately elevated total cholesterol of 230, but her HDL was 97. Her triglycerides were like 65. So her family doctor wanted her to go on a statin. And I told her she doesn't need a statin. She had a 0 calcium score with no risk factors. I would not put her on a statin. Anyway.
Lucille, if I messed that up, let me know, and I'll make sure we go back to that. If I messed up the question. Until then, I want to go to, let's get Steve up here. Did Doc ever reveal his current daily stack of vitamins and supplements? And he did.
Yeah, he went over that. You must have fallen asleep last week when I did that, Steve. You may have narcolepsy.
No.
Where you fall asleep without any reason.
Steve's been working hard, man. He's been working every Tuesday night, and we're just glad to have him here this evening. What we'll do, Steve, is we'll get you a clip of that.
I'm glad he is here because I'm looking forward to my starter kit for my sourdough bread. Steve's going to get me started now. That's going to be my new hobby, is making my own sourdough bread, which is the only bread I'll eat. But I look forward to that. I think Steve's been having his own sourdough going for 30 years, maybe, or maybe longer.
I want to say he's had this starter for over 30 years. Steve, if I'm wrong, correct me. But I think it's a pretty good starter. I know that. He's been doing this for longer. It became cool. I feel like the last.
He was doing it way before it was cool.
Yeah.
Way before.
Yeah. So shout out to
he was cool before it was cool. He really was.
All the sourdough bread makers in here. Okay, let's get to another question here. Where am I at? I think I missed one. This is a good one. Carol is asking, are people having issues getting Mounjaro filled? Katie, you can chime in here as well if you're seeing anything from patients. What are you seeing, Pop?
I don't think they're having that many issues getting it filled. If you have to do a PA, a prior approval on something, it's always tough to go through it. But, because I write it, I don't have to deal with the things the nurses have to deal with. So Katie may be able to tell you more, Katie or Sherry, about that. I haven't gotten a lot of complaints about it, I don't think.
All right. Well,
let Katie chime in on that.
I'll be on the lookout here for a comment around that. Steve is saying that the starter came from Mona Lisa's 12 years ago.
Oh, that's a great restaurant.
You can't mess this up.
Okay, I hope I don't. I'd love to. I can't really fry an egg, but I want to be good at baking sourdough bread. I have a feel that I'll be good at it, and plus the house will smell really good with that too. I may not eat a lot of it, I won't, but during that eating window, a little local raw unpasteurized honey on a little bit of sourdough bread. I mean, it doesn't get much better than that.
I hear people coming down the stairs. That means we're heading towards the end of our show. Thank you for putting that in there, Steve. Dr. Ike is going to be coming on. If you have any last minute questions for Doc, go ahead and put them in the comments. I'll try to do a little rapid fire here over the next couple of minutes as Dr. Ike comes on to say hello, to say good day to all the Performance Medicine Show attendees. I see Elena here. What is Doc's take on berberine for weight loss and a recommendation for a brand?
I like berberine, especially if you're insulin resistant. It's kind of like metformin without the stomach issues that metformin can sometimes give people. So it's almost, I call it the natural metformin. So I do use metformin for weight loss as well. It just kind of combats insulin resistance, which is a major cause of weight gain. So I like life extension with that. I'm sure there's some other ones like maybe Now or some things, but the one we have is life extension. And I think it works pretty well. Great question.
Thank you for that, Elena. It seems Katie's saying we sell the Now brand as well.
That's right. Okay.
Super cool. Roel, thanks, man. Thank you so much. We appreciate you being here
Thank you.
tonight. We appreciate every one of you. Thank you guys for hanging out with us every single Tuesday night at 7 p.m. This is where we answer your health and wellness questions. Doctor, are we going to have a Dr. Ike appearance tonight, or is it not?
I don't know if we have a Dr. Ike appearance tonight or not. If he comes down here, we'll see him. I hope he comes down.
A few more things, guys. If you are in the Kingsport area, Emily Curitan, our brand new licensed medical esthetician in the Kingsport office, Kingsport Red House, open house November 1 through 11. So if you're around the Kingsport locations, go check out Emily. Say hello. She's doing free skin consultations and complimentary brow or lip wax, excuse me. So go ahead and check her out over the next couple of weeks. And if we have no more questions and we have no Dr. Ike, what we're going to do, guys, is we're going to call it an evening. We're going to let Dad go get some new UT gear. You only got 5 days.
I'm going to go to the mall tonight if it's still open. If we still have a mall here, I'm not sure if we do.
All right, Pop.
Hey, thank you, Ben. It's been we'll get Ike on there next week. I think maybe he might have been misbehaving a little bit. That's why he's not down here, because I heard Jitty yelling at him. So last night on Halloween night, he got out and got in the mud after he'd just been groomed and clean. He looked terrible last night. The mud was caked all over him. We were bathing him at 11 o'clock last night because it was awfully dirty. But that wasn't a lot of fun either.
Well,
he is a good dog.
He's a pup. He's a pup. It seems particle size. So Lucille was saying particle size. So let me try to answer this real quick for her. So this remnant cholesterol versus the particle size of LDL, I'm assuming, is what we mean.
Oh, I'm not sure what you mean by remnant cholesterol. I'll have to check that out. But particle size matters. ApoB is probably the most important thing on that panel. And then maybe the oxidized LDL, then the LP(a). But again, total cholesterol and LDL and HDL by themselves just don't tell the whole story.
All right. Well, guys, thank you so much. Lucille, what we'll do is we'll follow up on that next week. And we'll get a hopefully, because the Cleveland Heart Panel is such a big thing. It's such a big part of what we talk about here with heart disease. All right, guys. Thank you so much. Dad, thanks, man. Thanks for the time.
Man. All right.
Guys, we love you. We're out. And where's my outro? See you guys. Love you.
Don't go away.